Do COVID vaccines cause ovarian cancer, infertility, or other reproductive disorders?
Is it true that contagion is a myth and that the immune system doesn't exist and germs don't cause disease?
Can cancer be cured with diet and supplements? Welcome to the next episode of What's Crap on WhatsApp, the voice note show that investigates the crap shared in your WhatsApp groups. I'm Andisueme from podcasting company Volume.
And I'm Kaylee Clifford from Africa Check, the continent's leading fact-checking organization. Let's start debunking.
First up for today is an alarming graphic posted on Facebook that reads, official data shows huge increase in cases of ovarian cancer and deaths of newborn babies have hit critical levels. Are the COVID-19 vaccines to blame?
The graphic includes a link to the expose, a conspiracy website Africa Check and others have debunked before.
The article also makes other claims about miscarriage and infertility caused by the coronavirus vaccine. But is there any truth to these claims?
So Africa Check has previously debunked claims that messenger RNA or mRNA COVID vaccines alter human DNA. The vaccines can't do this, so they can't cause cancer.
And there is no truth to the myth that somehow the mRNA vaccine could inactivate the genes that suppress tumors, Memorial Sloan Kettering Cancer Center says.
Medical virologist Stephen Korsman told Africa Check that no safety studies have shown that COVID-19 vaccines cause ovarian cancer, and that there was no evidence of accumulation in the ovaries due to the vaccine.
What about claims that COVID vaccines cause infertility? Haven't they been proven to be safe for pregnant people?
That's right. Mayo Clinic says that it is recommended that people who are trying to get pregnant or might become pregnant in the near future still get their COVID-19 vaccine.
What about COVID-19 vaccines and miscarriage claims?
Korsman said that studies of miscarriage haven't highlighted the COVID vaccine or any other vaccine as a risk factor.
And according to Johns Hopkins University, published studies have found that there has been no increase in the risk of first trimester pregnancy loss for patients who have received any of the COVID-19 vaccines. And finally, how about COVID-19 vaccines and the deaths of newborn babies?
Well, the World Health Organization explains that it's important for pregnant people to get vaccinated because it will protect both the mother and unborn baby from severe illness from COVID-19. There is no evidence the vaccine causes deaths of newborn babies.
These claims are crap. Next up for today is a Facebook post that claims germs do not attack living healthy bodies and that there is nothing to be immune to, nor any need for, nor existence of an immune system. Wait, what?
Yep. The post includes claims that deny germ theory, the well-established scientific theory that certain diseases are caused by germs.
So what's going on here? Is there any truth to these claims?
Modern medicine has established that many diseases, like COVID-19, tuberculosis, and influenza, are caused by germs. These are microscopic organisms like bacteria and viruses. This model is known as germ theory.
All right, and the immune system?
The immune system is a complicated collection of bodily processes that work to prevent disease and infection. It includes large organs like the skin, which acts as a physical barrier to infection, as well as microscopic cells like white blood cells.
There is plenty of evidence that the immune system exists and that it prevents disease, from centuries of medical research to modern technologies like powerful microscopes, which allow us to see the body's immune system in action.
The Facebook post also claims that rather than causing disease, germs are in fact our friends, assisting us in many bodily processes from digestion to nutrient composition, to detoxification and healing.
This mirrors claims which Africa Check has previously debunked that viruses are not agents of disease, but simply byproducts of the body expelling toxins. This is false. These claims are simply crap.
Last up for today is a graphic published to Facebook with the heading How to Cure Cancer. It lists 3 diet rules to follow for 6 weeks.
The first rule is no meat, followed by organic food only. The third rule gives 2 options. either 1.5 grams of vitamin B17 per day by mouth or 1 gram of hemp oil per day by mouth.
To top it off, at the bottom of the graphic, a disclaimer in tiny font reads, "The preceding text was written by someone who has no medical license and should not be listened to at all."
Interesting. Yet social media users commenting on and sharing the graphic appear to be treating its contents as factual. So can any of these dietary measures actually cure cancer?
So there are more than 200 different types of cancer, but any one of these is usually a result of years of damage to cells caused by a combination of factors.
Unfortunately, there is no good research that suggests any specific change in diet can cure cancer. As the University of Texas Medical Center has said, there is no diet, superfood, vitamin, or drink that can cure cancer.
But prevention of disease is sometimes equated with treatment by the layperson, and there is good evidence that some dietary habits can lower your chances of developing certain types of cancer, but they cannot cure these cancers.
Research suggests that plant-based foods, which are often rich in fiber and phytochemicals, may protect the body's cells from damage, lowering the risk of cancer.
The World Cancer Research Fund recommends limiting red and processed meat and eating more fruits and vegetables. But again, unlike the advice in the graphic, this is to prevent, not cure cancer.
What about hemp oil as the claim suggests?
Hemp oil is often sold as a health supplement and comes from the seeds of hemp, a type of cannabis plant. It contains various fatty acids and small amounts of cannabinoids.
But there is not enough data to suggest cannabinoids can treat cancer in humans. What about vitamin B17?
Also known as amygdalin, vitamin B17 is found in some nuts, vegetables, beans, and fruit pips. The claim that amygdalin can treat cancer is false and has been debunked for decades.
Using amygdalin as a treatment for cancer can also be dangerous. It contains cyanide, a powerful poison that can result in death. According to UK-based Macmillan Cancer Support, people have suffered cyanide poisoning and some have even died as a result of taking amygdalin.
The bottom line, a healthy diet has many benefits for physical and mental health and may prevent some types of cancer, but no diet or supplement has been shown to cure cancer.
That's all the time we have for today. Now you know what's crap and what's not.
Your friends and family can sign up for our show over WhatsApp. The number is 082 709 3527. Make sure to save us as a contact in your phone and send us a message.
You can find the show wherever you get your podcasts, from Apple to Spotify. If you listen there, you'll find show notes and a link to the fact checks.
Remember that you can send us a WhatsApp message, picture, video, link, or voice note that you need fact-checked. Just forward them to us on WhatsApp. Our theme song is composed by John Bartman. I'm Katie Clifford.
And I'm Andisueme. Bye for now.
Volume.